Hi, my name is Katherine Howell. I'm a neurologist undertaking my PhD in the Incidences and Aetiologies of Severe Epilepsies of Infancy through the University of Melbourne, the Royal Children's and the Murdoch Children's Research Institute. I'd like to express my thanks to Lee and Sue Clifford for their generous support of my PhD and to Kathy North and Paul Monagle for the chance to speak today. So the Severe Epilepsies of Infancy, or SEI, are a group of disorders characterised by frequent seizures, often occurring multiple times a day, that are typically resistant to treatment. These conditions are typically associated with very severe developmental impairments, which are at least in part due to the damaging effects of seizures on the developing brain. These conditions are due to a variety of acquired and congenital causes, and causes such as brain injury, brain malformations, chromosomal abnormalities, and inborn errors of metabolism are well described. However, there are many features of these conditions that are poorly understood. For many children, despite extensive and invasive testing, the cause of these conditions is not found. In these children, the cause is presumed to be genetic, and in recent years, genetic causes are beginning to be identified. There is, however, very limited epidemiologic literature in this group as a whole, and in particular, there's no data at all on the relative incidence of each genetic SEI. And despite an increasing recognition of the importance of genetic causes, clinical genetic testing currently remains very limited. So in addressing these gaps, the study aims to understand the incidence and causes of SEI. So why are these things important? Well, firstly, finding and understanding the genetic causes is important at the individual patient level in providing an answer for the symptoms experienced, providing prognostic information for the child, stopping investigating for other causes, and providing accurate reproductive counselling to families considering more children. At a broader level, understanding the causes is critical to the development of new treatments to improve outcomes for these devastating conditions. Secondly, the epidemiologic data is vital to understanding the contribution of each gene at a population level, and this is needed in order to determine how best to use new genetic technologies to diagnosing these conditions, and also to highlight where future research efforts should be focused. So I'm conducting a statewide study of SEI in Victoria over a 5-year period between 2011 and 2015. The study has 2 phases. The first, the screening phase, aims to identify all children in the state with SEI by searching Victorian EEG and tertiary neonatal unit databases. The second, the assessment phase, involves studying the clinical features of children with SEI and, where possible, to determine the cause of their condition. This involves reviewing medical records of these children, reviewing EEGs, reviewing brain imaging and other investigations. In addition, for children with unknown cause, these children will be invited to undergo a detailed clinical assessment and research genetic testing. To date, the data collection is progressing well. I've completed collection of the screening phase data for 2011 to 2014, and 2015 data collection is underway. Clinical assessment of infants with SEI from 2011 to 2014 is near complete, with less than a handful of infants still to be assessed. The research genetic testing so far has only been undertaken in a minority of patients using multi-gene panels and targeted single gene testing. However, excitingly, we're about to undertake genetic testing in all infants of unknown cause using a next generation genetic technology, whole exome sequencing. So what are the results so far? So accurate data analysis will not be available until data collection is complete. However, our preliminary data shows that there were 155 children over a 4-year period in Victoria with SEI. This equates to an approximate incidence of 50 per 100,000 per year, or 1 in 2,000 live births. And this extrapolates to approximately 160 children with these conditions per year in Australia. For comparison, this makes this group of conditions close to twice as common as one of the well-known neurologic disorders of childhood, Duchenne muscular dystrophy. These disorders are extremely severe with a high mortality rate. 12% of this group of patients was deceased by age 2 years. And importantly, 50% of children have an unknown cause for their condition despite the clinical investigations and are awaiting research genetic testing. So in the next 12 months, I'll complete the clinical data collection, research genetic testing, analysis of the epidemiologic and clinical data, and I'll undertake a health economic analysis looking at the yield and cost effectiveness of early genetic testing compared with current clinical standard investigation. This data will be important for changing clinical practice and will also form a basis for my and others' future research, both in this patient group and in this group of conditions as a whole. So, as listed in this slide, there are many people involved in this study who I'm very grateful to. In particular, I'd like to acknowledge my supervisors, Simon Harvey and Ingrid Sheffer, and I'd like to reiterate my thanks to Lee and Sue Clifford for their generous financial support of my PhD. Thank you very much.